Hi, it's Dr. Grace Sturdivant with OtoPro. I'm here in the beautiful Highlands, North Carolina, and I thought this might make a good backdrop to talk to you about something that is not such a relaxing issue. Tinnitus. It's no surprise that my clients ask me about tinnitus all the time, very routinely, especially considering that 50 million Americans will experience ringing in the ears at some point in their lifetimes. 10 million Americans are estimated to be severely impacted by it, and about 2 million are estimated to be debilitated by this intrusive ringing in the ears. So what is it? Where does it come from? As I've tried to find some resources that exist outside of medical journal articles that get really into the weeds, it's been difficult to find something to share with my clients that gives you enough detail and understanding to truly get a grasp of what's probably going on. So with tinnitus being such a wide-ranging problem affecting so many people, it is often misunderstood. I would often see patients coming to me in clinic that would have cotton balls stuffed in their ears because of them trying to drown out the ringing sound, and that's not going to be effective because what you're hearing is actually being generated by the brain. It's not heard in the outside world. In fact, there's no way for anyone else to hear what you're hearing, but we can see what you're hearing in a certain way on a functional MRI. So check out this visual. On the left, you'll see a typical person, their auditory cortex lighting up in a normal way, and then look at all of the extra activation in the tinnitus patient represented on the right. This physical realization of what people are perceiving has given a lot of validation to people, so let that be of some comfort to you. You are actually hearing what you're hearing. Bear with me while I offer a quick review of how we hear. This lays a good foundation for understanding the neurophysiology of what's happening in this process. So sound occurs in the outside world. It's funneled into your ear by the pinna, travels down the ear canal, vibrates your tympanic membrane or eardrum, which then vibrates the tiniest bones of your body, the ossicles, behind the eardrum, the smallest of which, the stapes, moves in and out of a little window, which then vibrates fluid inside your cochlea. And your cochlea is the little 2.5 turn snail shell organ of hearing that sits just below your mastoid bone behind your ear. Now, if you were to roll out the cochlea, unroll that little snail shell, what you would find essentially are little hair cells that act as a piano keyboard. The hair cells that are first hit by that noise stimulation are coded for the highest pitches that we hear. And then as you move down, it's like you started at the treble end of the keyboard and you're moving right down into the bass tones as you move farther and farther down the cochlea. When you think about that, it's no surprise that noise-induced hearing loss typically affects the high pitches the worst. The clarity of speech, why people sound like they're mumbling when you have noise-induced hearing loss. Most typically, it's right there in those high pitches that we need to hear the consonant sounds of speech. So moving right along with our anatomy and physiology lesson, once those outer hair cells of the cochlea are stimulated, they generate an action potential. That action potential is sent to your brain. It's actually sent to the opposite temporal lobe into the auditory cortex, where it's then processed, and there's sense and meaning made of that sound. Well, that's why I've been quoted so many times as saying, we hear with our brains. I mean, essentially everything up to the brain is just the transducer. Without the brain's processing and meaning attached to the sound, there would be no point. So on that auditory cortex, guess what? It is also organized like a piano keyboard, bass to treble. There's actually a little surface area devoted to coding all these pitches that we hear. So when there's a certain hair cell not sending that sound to the brain, not sending that action potential to the brain. The brain doesn't like that. It's searching for a sensory input that's not coming. And I like to compare this to a phantom limb syndrome. You may have heard of people who have experienced the loss of a certain body part, a limb, a hand, an arm, and occasionally they may even experience pain in that system that's not there anymore. Well, the brain is trying to fill in those gaps. It's searching for sensory input that's not coming. And that's a very loose analogy, but I think it's an appropriate one in most of these situations. So let's give some examples. Maybe you shoot without your hearing protection and your ears ring for a little while. It's kind of annoying. What's happened? Well, you've damaged some outer hair cells and they're not sending the signal to the brain the way they should. Now, this could be temporary. Oftentimes when say you go to a concert or good old college days, you come in from a night out on the town and your ears are ringing when you get into your quiet bed. But then maybe by morning, it's not there anymore. The ringing's gone. So does that mean you're okay? No, unfortunately it doesn't. Those hair cells will withstand that damage over and over. They'll really try to recover, and they'll recover a certain number of times where you'll have that we call it a temporary threshold shift, where your hearing may sound a little stuffy, things might sound a little muffled, you get some ringing, but then those hair cells recover and you're back to going again. But after enough times, the hair cells are not going to recover, and that's where permanent sensory neural, that's what we call it, hearing loss sets in. So before I get into recommendations for those of you who are struggling with tinnitus, I want to mention a researcher that I've been following closely out of Georgetown University, Josef Roschecker. Now, he has a lab that is devoted to tinnitus research and neuroscience, and it is fascinating. I'll try to link some articles and some of his conversational interviews. But he often describes the limbic system's involvement in creating a gating system, essentially a noise cancellation system deep in our brains to basically cancel out the tinnitus. And serotonin, dopamine are involved, which helps to explain links with depression and stress hormones. We know that with noise exposure combined with stress, then the ringing is going to be more severe. That's why our war veterans are particularly at risk for debilitating tinnitus. In fact, it's the #1 reported benefits cause in the VA, second to which is hearing loss. So looking at how these neurochemicals are involved with that gating system helps to explain why insomnia, just restless sleep, spikes in stress, if you're going through a really stressful time in your life, how those brain chemicals can exacerbate the ringing and make it worse. So oftentimes when people come to me and they tell me that the ringing is getting really bad, I'll start to ask them if they're going through a really stressful time or how they've been sleeping lately, how much caffeine are they intaking. I recommend drinking a whole lot of water, trying to do your best to prioritize sleep and help your body recover and help those brain chemicals come back to an equilibrium place with sleep. That can do wonders. I also recommend using a white noise machine, just loud enough, not too loud, preferably with a sleep timer attached so that it's not going all night long. But that white noise can help put a Band-Aid of sorts, allowing that stimulation to reach the brain and hopefully tell the brain to stop generating that sound, or at least stop making it so apparent to us. You can download apps on smartphones that have different types of white noise, pink noise, brown noise, and the like, and you can find which pitch-weighted noise is most effective for the ringing that you hear. Now, there are some tinnitus retraining therapies. There are some mindfulness techniques that are targeting tinnitus therapy, tinnitus treatment. And what those essentially are doing are helping you to control those neurochemicals, the limbic system, and helping it to do its job of that gating system that I was talking about. Now, one strategy that was quite effective for many of my patients when I was still in the hearing aid world, I would put them into the sound booth where I had just tested their hearing, and we would pitch match and loudness match their ringing as best we could. And then I could program into their hearing aids a little background noise to be almost like that white noise machine in your bedroom at night, so that it's constantly soothing and providing stimulation for that very discrete area of damage that's causing the perception to spike. And that can be effective. Now, there is no cure for tinnitus at this point, but the strategies that I've mentioned have been effective for a lot of people. Now, in the future, there may even be some deep brain stimulation that's worked in some Parkinson's patients and things like that. I don't see that coming any day soon, but who knows? I don't recommend the medications and supplements that you may see advertised for the lipoflavonoids and things of the like. I haven't seen enough conclusive research to show their effectiveness. But oftentimes these strategies that I've mentioned do help. Don't put hearing aids off too long. Hearing aids can help with tinnitus. If you're a borderline candidate, I encourage you to give them a try. Most audiology clinics will offer a trial period with hearing aids so that you can get a grasp of what that stimulation may look like for you, what that might feel like, and how it might affect your daily life. I do encourage you to give it at least 60 days, preferably 90, of a good old college try And that's because of how plastic our brains are and how you've got to give your brain a chance to reorganize with that new auditory input to make the most of it. Please let me know if you have any further questions. I sure hope this video has helped.